When you see stuff on TV, you see lots of people working and almost chaos, okay? But in a trauma center, it is sort of chaos, but it's organized chaos. Everybody has a job. When someone comes in this room, every nurse that's in here has a job. And we monitor all of that, and we make sure that they do their job. Somebody's a recorder, somebody's responsible for the blood pressure, somebody's responsible for doing this and doing that. The doctors that come here, the ER doctor is usually responsible for making sure the patient's breathing okay and has a good airway. The trauma surgeon comes in, he's responsible for organizing all this, making decisions about what should be done, when it should be done, where they should go. And all those things happen at an instant. They're happening constantly, and like when I come in this room, there's a million things going through my head about what needs to happen to this person. Do they need to be stabilized and shipped? Do they need to have the CAT scan done? Do they need to have blood given to them? Do they need this? I need to keep them warm. I need to make sure the nurses are getting IVs started. I need to make sure that they're breathing okay. Do they need to have a chest tube in? Do they need? And when you see it on TV, it's sort of chaotic. But the same thing is happening. Before we became a trauma center, it was chaotic. And that was it. It was chaotic. It wasn't organized. It was not timely. And that was one of the main reasons and trauma was evolving during that time, but one of the reasons that my group, who's a general surgery group, went to the administration and said, we need to do this for people because we're not organized. And until you take on that responsibility and say, yes, we're going to do it that way, it doesn't happen that way. We can tell you it's hard work to get it here, and it's hard work to keep it here because chaos tends to go into chaos. Organized chaos takes work, and we work very hard at making sure that happens. And that happens in every trauma center across the United States who is truly committed to being a trauma center. There's night and day difference about how people are treated, and you can go to a hospital, and if they tell you, yes, we take care of trauma, the main question you have to ask them is, are you a designated trauma center? They may say, yeah, we're a trauma center, but the answer is, are you designated? When you get designated as a trauma center, a group of people from other trauma centers come in and they look at you with a fine-tooth comb. It's more strict than any JCO look you've ever seen. JCO tends to look at sort of paperwork kind of stuff, but what the trauma designation process, they look at your paperwork, they look at your structure, how you got your hospital organized as far as where your facilities are and how they work. But more importantly, they look at patient care. They look at chart after chart after chart after chart. And I will tell you, because I do site surveys for other trauma centers, I go in there and I want to find anything that's wrong, any little bit of thing that's wrong with that care, from the minute, whether blood pressure was taken every 30 minutes or every 15 minutes. And that makes a difference in some people because the blood pressure could fall in that short period of time. So you're looking at all those issues, not to be critical of it, but to educate the trauma center. You know, as we've learned over time, you learn more and more by people coming in and saying, here are some things you can tweak and you can make them a little bit better. I mean, we're not perfect. We will never be perfect. We continue to grow, and because the system keeps changing, we keep changing. And so but that kind of commitments, I'm just telling you, if you don't have a commitment from the hospital to employ the people like Betsy and like Denise who does our registry, and have ED managers that are like Krista that are tied in and say, okay, we're going to do the right thing for these people, and even if it kills us, we're going to get it done. And even if we make people mad, we're going to get it done. We're going to make trauma care the best it can be. And so that's the difference. And
you have that commitment here.
Yes, we do. And you want to put an expletive in front of that? Yes, we do.